The carpal roller can be used to treat carpal tunnel syndrome, medial and lateral epicondylitis, also known as golfer's and tennis elbow, as well as plantar fasciitis, as well as other maladies of the wrist, hand, forearm, and foot. Carpal tunnel syndrome is a result of an increased pressure or compression on the median nerve and the associated tendons as it crosses the wrist. Symptoms of carpal tunnel syndrome can include numbness, tingling, loss of motion at the wrist or fingers, as well as weakness of the hand. Causes of carpal tunnel syndrome may include a fall, a predisposition to a small carpal tunnel region, pregnancy, repetitive motions such as keyboarding, guitar playing, as well as other symptoms as well. Use of the carpal roller will provide a myofascial massage to the muscles, tendons, and other soft tissue structures within the wrist and forearm. To begin, place your palm on the carpal roller as shown. Firmly, yet gently, roll the carpal roller up your forearm. In stopping just before you get to the bony prominence of your elbow, as putting this area over the carpal roller will be painful and not beneficial in pain reduction. Repeat this motion back and forth up your forearm and hand for 5 minutes, 3 times a day, more or less depending on tolerance and muscle fatigue. It is not uncommon to experience some soreness within your forearm and wrist musculature after use of the carpal roller, as you are providing a lengthening and soft tissue massage to this area. With that said, please remember that the carpal roller is intended to provide a non-painful symptomatic reduction, and therefore at no time during use of the carpal roller should you experience any sharp or shooting pain. Tennis elbow occurs when there's an inflammation of the tendons that connect the forearm musculature to the outside of the elbow. Tennis elbow can be caused by repetitive motions, a fall, overuse or an imbalance of musculature within the forearm, as well as activities that require simultaneous wrist extension and forearm supination, such as playing tennis. When treating tennis elbow using the carpal roller, begin by placing your forearm with your palm up, making sure to start after the wrist, as going over the bones in your wrist will be painful and not beneficial in treatment of tennis elbow. When starting, put some firm yet gentle pressure through the carpal roller up towards the backside of your elbow. Again, once you reach just before the elbow, ensure not to go over the bony prominence of the elbow. After you've reached that elbow area, return back to your starting position. Repeat these motions up and down the backside or outside of your elbow and forearm for 5 minutes, 3 times a day, more or less depending on tolerance and need. Medial epicondylitis is an inflammation of the tendons connecting the forearm muscles to the inside of the elbow. Causes of medial epicondylitis include repetitive motions, a fall, or an imbalance or weakness within the forearm musculature. Activities that require simultaneous wrist flexion and forearm pronation, such as playing golf, may exacerbate your symptoms. To begin treatment of medial epicondylitis, place your hand, palm down, on the carpal roller. Firmly, yet gently, roll your forearm up towards your elbow, again, stopping just before the bony prominences of the elbow. Once you get to the elbow, return back to your starting position, just crossing the wrist. Repeat this movement up and down the inside of your elbow and forearm for 5 minutes, 3 times a day, more or less depending on need and tolerance. Plantar fasciitis is the most common cause of heel pain, and when the plantar fascia, a thick band that connects the heel bone to the toes, becomes swollen or inflamed, you may experience the symptoms of plantar fasciitis. This can be caused by having symptoms such as a high arch, flat feet, or an abnormal gait or walking pattern. The fascia can become overworked or overstretched, and thus create tears or inflammation within the plantar fascia. To use the carpal roller for plantar fasciitis treatment, sit in a comfortable chair with good posture. Place your affected foot on the carpal roller just below the ball of your foot. With a firm yet gentle manner, roll your foot over towards your heel. Once there, return back to the area by the ball of your foot. Please remember that when using the carpal roller to treat these symptoms, you may experience some muscle fatigue or soreness in doing so. At no time during or after the use of the carpal roller should you experience any shooting or sharp pain.